So we have reports that no one is hearing the video, so I will share again.
I was wondering about that. Music.
Latin America is a relatively young region, but it won't be for much longer. An aging population creates a number of challenges for the governments of the region, which are responsible for providing high-quality social protection to their residents, and for doing so in a fiscally sustainable way. What is the impact of an aging population on pension and healthcare systems, especially for the most vulnerable groups? How does informal labor affect these systems? What are the effects of technological changes on jobs and protection of the elderly? CAF, Development Bank of Latin America, presents the 2020 Economy and Development Report, EDR, Social Protection for the Elderly, Present and Future Challenges in Latin America, a key document to learn how to address the challenges in the design of pension and healthcare systems in the region, and work towards universal and high-quality social protection for the elderly. Download it at www.cioteca.caf.com.
Good morning. I am Wendell Constantine, and on behalf of the CAF Bank of Latin America, I'd like to welcome you of the 2020 Economy and Development Report, Pensions and Healthcare Systems in Latin America. The challenges posed by aging, technological change, and informality. The report prepared by CAF focuses primarily on the issues of pensions and the provision of healthcare services and care for the elderly. The report presents a comprehensive and in-depth review of both systems, taking into account the interactions between the demographic structure, labor market, and those factors determining their financial balance and sustainability. Delighted to have with us today the Minister of Finance of Trinidad and Tobago, the Honourable Ember, and a top-tier group of experts who on this important topic. And we invite you to share your opinions on social media with the hashtag REDCAF, REDCAF, and to follow CAF's Twitter account at AgendaCAF. That's AgendaCAF. At the outset, I'd like to give the floor to Pablo Sanguinetti, Vice President of Knowledge at CAF. Good morning, Pablo.
Thank you. Good morning, Wendell. Good morning to everyone. And I thank all the people that is connected to this virtual seminar where we're going to present our RID 2020 report. As you all know, modern states allocate a lot of resources to finance transfers that seek to protect workers and their families from various risks and to promote equality and better income distribution. The Social Security programs are key to sustain social and economic development objectives in all the countries, but especially in those in which income inequality is pervasive, like Latin America. The COVID-19 pandemic has made clear that a well-functioning social security system is a key mechanism to protect vulnerable families. An important ingredient of the social security systems are those programs associated with the income and health support to senior old people that have retired from work. This system has created significant fiscal pressures on public budgets in recent years. One important factor is due to demographics. People are living more years into adulthood, so there are fewer active workers per retiree to finance pensions, and all people spend more on health. This complicates the financial account of these systems. Latin America is still a young region, but will not stay that way for a long time. Trinidad and Tobago is not free from this reality. The mean age of population in Trinidad and Tobago has increased 4.3 years in the last decade, reaching 36.2 years in 2020. This is in the upper limit of the distribution of the region. Also, in Trinidad and Tobago, 12% of the population is of 65 years old or older. Another important factor is technology, which can affect labor markets trends, increasing the participation of independent workers in the labor force, which could weaken the source of funding of pension and health system, which traditionally depends on formal workers and employers' support. Related to labor market issues, Latin America also faces the problem of labor informality that affect both the access to workers to Social Security and the financing of these systems. In the case of Trinidad and Tobago, informality affects between 25 and 33% of the workers. This is below the Latin American average. The relative low participation of women in the labor force is also a problem in Trinidad and Tobago and Latin America, because this detracts resources from the Social Security system, given that the fact that benefits tries to cover all the population of 75 years or older, mainly through non-contributive pensions. To these long-term trends, we have to add the effect of the current pandemic. The increasing unemployment that the crisis has caused will raise informality, of course. Also, the increase in public expenditure, deficits, and debts as a response to the emergency will leave less fiscal space to finance the additional demands that the pension system and health system will require as a consequence of the changing demographics. As we have already seen in Colombia, tax reforms to raise public funds, even for social expenditure purposes, face difficult political challenges. In addition, the COVID disease seems to have left health problems in infected people that could affect their quality of life at older ages. In this seminar, we'll be presenting the main lesson of the CAF report on economics and development. It offers a diagnosis of the pension and health system in Latin America and Trinidad and Tobago, and the public issues faced by these systems in context of accelerating trends of aging population, labor informality, and technological change. But before the presentation, we have the honor to have Ember, Minister of Finance of Trinidad and Tobago, as a keynote speaker. Surely he will address the challenge the country encounters on this important issue of public policy. I want to thank the Minister for his willingness to join us. After the presentation of the report, there will be a discussion panel integrated by well-known specialists. So I want also to thank all of them for accepting our invitation. I finish here with the hope that we will enjoy an interesting seminar on such an important topic for the region. Thank you.
Thank you very much, Mr. Sanguinetti. Yeah. Next is the keynote speaker, the Honourable Ember, Minister of Finance of Trinidad and Tobago. Good morning, Minister.
No.
I'm afraid I was muted. I apologize. And it's good to see you again, Dr. Sanguinetti. So Dr. Pablo Sanguinetti, Vice President of Knowledge of CAF, Mr. Douglas Camacho, Deputy Chairman of the National Insurance Board, Mr. Gianpiero Liancini, Representative of CAF in Trinidad and Tobago, distinguished panelists and speakers, members of the media, other distinguished ladies and gentlemen. Good morning. I'd like to thank the CAF Bank for inviting me to be the keynote speaker for what I consider to be a very timely and especially important discussion on pension and healthcare systems. I am hopeful that my initial discourse complement the report being presented by Mr. Fernando Alvarez and would also lay a proper foundation for the subsequent discussion by what can only be described as a very well qualified and eminent panel of experts. However, it is quite a task to speak in depth about both pensions and healthcare. So in the time allotted, I will focus primarily on the Trinidad and Tobago experience with our national insurance pension scheme. I note in that respect that the CAF report on pension and healthcare systems in Latin America, challenges posed by aging, technological change, and informality, the authors have written quite extensively on healthcare systems in the LATAM region and on the relationship between aging and healthcare requirements. So there's a lot of material there. In Trinidad and Tobago, when we first launched our national insurance scheme, the NIS, in April 1972, almost 50 years ago, the scheme offered two benefits: a retirement grant, as opposed to a pension, and a funeral grant. The NIS retirement pension was introduced in 1975, and in 1977, the first payment of this pension was paid to 1,143 persons at a total cost of 2 million Trinidad and Tobago dollars, or about US 800,000 at the time. By way of contrast, in 2017, 40 years later, according to the 10th actuarial report of our National Insurance Board, the NIB, retirement benefit expenditure cost 3.8 billion Trinidad and Tobago dollars, or over 550 US million dollars, paid out to 108,116 beneficiaries. So we've moved from just over 1,000 pension payments on inception 40 years ago to over 100,000 pension beneficiaries. And the cost has moved from under $1 million US to 550 million US dollars per year. And that is a 2017 figure. It's more now in 2021. Today, the NIB provides services to over 588,000 persons and offers 23 benefits. However, like many such schemes, it faces serious sustainability challenges and risks of reserve exhaustion, whether it is from expenditure of the NIS exceeding its income, or from the assets of the National Insurance Fund becoming depleted within the next 25 years, as projected in the most recent actuarial report, the 10th actuarial report. The root cause of this problem is that our life expectancy in Trinidad and Tobago, like many other countries, has steadily increased over the last 50 years, while birth rates have decreased. The NIB has thus projected that by 2066, the 60-plus population in Trinidad and Tobago will be almost double its current size, while the group we rely upon to sustain the fund, the 16-year to 59-year age group, will decrease by at least 25%. I would say that's a double whammy. In this context, it is noteworthy that in the report on pensions and healthcare, the authors made the point that in most countries in Latin America, the proportion of older persons is estimated to have doubled or will double over a period of 20 to 30 years. By contrast, countries such as France and Sweden experience similar growth over a much longer period, 115 years and 85 years respectively. These challenges are not unique. According to the Organization for Economic Cooperation and Development, the OECD, globally, the main challenges faced by retirement systems include longevity, the lack of easy access to pension arrangements, low levels of financial literacy, and low long-term growth. Whilst this is not an exhaustive list by any measure, as you would see, these challenges are the main focus of this conference. The challenges associated with aging, change in technology, and informality. This is compounded by the pernicious effects of low long-term growth. The first topic I'd like to touch on is longevity. This subject is particularly useful for creating a nexus between the themes of healthcare and pensions. Given the unpredictable nature of the current pandemic, the real effects of COVID-19 on mortality and morbidity will not be known for a number of years. In fact, it seems this pandemic will never end. As a result, my comments on longevity are in the context of what the current data supports, what we know now. Globally, life expectancy has been increasing significantly over the last couple of decades. Trinidad and Tobago is no exception, and over the last 50 years, life expectancy at birth in Trinidad and Tobago has grown substantially from 64.8 to 73.6 years. The UN, in fact, projects that average life expectancy in Trinidad and Tobago will increase to over 83 years within this century. Whilst many studies show a correlation between improved life expectancy and income level or access to healthcare, in my view, the biggest contributor to the increase has been the advancement in medicine, and more specifically, medical technology. Technological advancement in medicine has also significantly improved the early diagnosis of medical conditions, and as a result has completely revolutionized preventative healthcare. In general, medical advancement has changed the landscape of the medical world at both ends of the spectrum. Infant mortality rates are currently at their lowest historical levels, while people are living longer. This has resulted in an explosion of the Earth's population from 2.5 billion in the 1950s to over 7.8 billion today. Now, while I'm happy that, barring unforeseen circumstances, we, people like me, can look forward to many more years in our lives, I am also fully aware of the effects that a longer expected life will have on the retirement system of our country and the implications of longevity risk. Several international actuarial bodies have defined longevity risk for an individual as the extent to which the person's lifespan exceeds his or her expectancy. For example, an individual may have prepared for retirement by accumulating enough resources to support themselves for 15 years of life after retirement. However, if that person lives longer than expected, they are exposed to the real risk of running out of resources. From where I sit as a policymaker, this shortfall in retirement resources by the individual ultimately increases the obligation on the state for support. Now, if we combine this individual scenario to all members of a working society, you get a sense of the nature and magnitude of the challenge. So how does this manifest itself in the real world? In Trinidad and Tobago, it affects both the social pension systems as well as the occupational pension systems. As previously mentioned, our NIS provides some level of insurance and pension benefits for almost 600,000 persons. And the largest portion of that support is in the form of retirement benefits. According to the 10th actuarial investigation into our NIS, the proportion of persons over the age of 60 being supported by the NIS has been increasing over the years from 11.1% during the 2005-2007 period to 14.2% in the 2013 to 2016 period. This aging profile, coupled with the longer life expectancy of Trinidad and Tobago citizens, means that the NIS is expected to pay more for a longer period. As Mr. Camacho will attest, wearing his hat as the deputy chairman of our NIB, this creates an additional challenge in relation to the sustainability of our NIS. Longevity risk also affects the occupational pension plans, both public and private. Whilst the specific data showing the exact effect that increased longevity has on Trinidad and Tobago's occupational pension arrangements is not easily available, according to the IMF, in their 2012 Financial Stability Report, on average, if persons in a retirement system live 3 years longer than expected, it will have at least a 9% increase in retirement liabilities. Further, unlike the 1970s, when we first offered the retirement benefit, occupational pension liabilities are now measured in the billions. And in the aftermath of multiple energy price shocks and a seemingly never-ending pandemic, you get a sense of the magnitude of the risk and its financial impact on an economy. In private pension arrangements, longevity risk ultimately increases the actual retirement liabilities, which in turn threaten the funded position of the plan and its sustainability. So longevity risk, if not addressed properly, has the real possibility of undermining the fiscal sustainability of a country over time. The majority of that risk is borne by the government, so it is in our best interest to proactively manage this. Cognizant of these facts, the 10th actuarial report on our NIS recommended the implementation of 4 transitory reform measures to improve the sustainability of our National Insurance Fund. These include the contribution rate increases in the short term, which while yielding more income for the fund, are not popular. Bringing more equity in the NIS by reducing the pension for those taking their retirement before age 65, an even more potentially unpopular concept. Currently, individuals can retire as early as age 60 and still get the full minimum pension. 3, freezing the minimum pension until it is at most 80% of the minimum wage. At present, our minimum pension is equal to 100% of our minimum wage. And fourthly, increasing the retirement age over a 10-year period from the current 60 years to 65 years of age from the year 2025. This option allows persons to continue to retire at 60, but at a reduced pension, or go to 65 and receive a full pension. The actuaries have proposed that the pension be reduced by approximately 6% for each year that an individual retires before the increased age of retirement. It is noteworthy that whereas the typical age of retirement in Trinidad and Tobago, both in the public and private sectors, is 60 years, there are some areas in the public sector, notably in local government, where the retirement age is already 65 years of age. However, the initial public feedback on this proposal for increasing the retirement age has been mixed, with some welcoming the opportunity to work for 5 more years and others complaining that an increased age of retirement would adversely affect promotional opportunities with the public service by making them wait 5 more years to be promoted. Additionally, the idea of a reduced pension at age 60 would certainly be unpopular in many quarters. This issue is therefore still under active consideration with no firm decision yet. In addition to the financial effects on the retirement systems, an aging population introduces various infrastructural and developmental challenges. As our population maturity profile increases, countries need to ensure that the necessary support systems are in place to support this vulnerable section of society. This support extends beyond just ensuring proper health management, but also has implications for transportation, social services, and security. In relation to another theme of the conference, that is informality, I wish to address this from a wider perspective. According to the OECD, the challenges associated with informality flow from a large proportion of the population, mainly in emerging economies, having no pension coverage, which exposes them to economic risks. As mentioned previously, any shortfall in accumulating resources to support retirement may ultimately have to be borne by the state. Therefore, it is imperative for any government to manage this situation properly for the benefit of all citizens. Globally, the majority of informal workers are the self-employed, casual workers, independent contractors, transport providers, domestic workers, and laborers in micro-enterprises. As a government, we have been actively monitoring this issue and exploring the possibility of the full incorporation of informal workers into the NIS. Of course, the costs and benefits of incorporating self-employed persons into any national pension scheme must be very carefully examined, since there would in all likelihood be significant costs at the beginning of any such move. As articulated in the 10th actuarial review of our NIS, the proposed framework would make it mandatory for all working persons, whether formal or informal, to register and contribute towards the NIS. The benefits of this approach include much needed coverage for the most vulnerable in society. And it is felt that the new contributions from the informal sector will also provide much needed support for the long-term sustainability of the NIS. Another advantage of the inclusion of the informal sector is the larger and more diversified pool of resources to support future claims. While it may appear that this proposal is a win-win scenario for all stakeholders, the implementation of this initiative does present its own challenges. In general terms, low-income informal workers have little extra money to put aside for retirement, and the resulting pension may be too low for their future needs. Additionally, if they do manage to save, they prefer to keep their savings in a more liquid form to support themselves during hard times or to support other goals, such as funding their children's education. The uncertain nature of jobs in the informal sector also motivates many persons in the sector to keep their savings in a liquid form, as opposed to long-term financial vehicles like the NIS. While we must all understand and empathize with the financial realities many people face, I would like to suggest that one of the root causes for this hesitancy to get involved in long-term saving is a lack of knowledge on the subject matter, the nature of the products being offered, the potential benefits, and the underlying risks. The need for the population to be able to understand the financial products available to them is vital. In this context, our government has been supporting various initiatives in relation to financial literacy. For example, our central bank manages through the Office of its Financial Services Ombudsman a national financial literacy program. The bank has been actively working with stakeholder groups, our Ministry of Education, and the general public to promote a deeper understanding by the public of financial matters. The last topic of this conference directs me to comment on the challenges with the use of technology in pension and healthcare systems. However, instead of focusing on challenges, I would rather discuss the potential benefits of smart technological deployment. There is no disputing the positive effects of the development and implementation of new technology that these effects have had on the longevity of mankind. But the benefits of new technology extend beyond medicine. According to the International Social Security Association, the effective governance and use of technology is key in providing high-quality service in a time of growing expectation and demands. The use of new tools such as artificial intelligence, big data, blockchain technology can improve any aspect of social security, private pension plans, or health system administration. Technology can also play a pivotal role in providing retirement and health coverage to the increasingly mobile workforce, for example, by connecting through digital platforms. Many countries have also utilized mobile phone technology, in particular, to structure financial inclusion type products that are specifically targeted to the more vulnerable in society. In Trinidad and Tobago, we have witnessed technology being used to conduct health diagnostic transactions over mobile phones during the current pandemic. In these cases, the doctor had electronic access to the necessary information on his phone, discussed the matter with the patient on his phone, and prescribed a course of action and medication, all accomplished through mobile technology. While some of the more advanced tools I mentioned previously, such as blockchain technology, have not yet been fully developed and deployed in Trinidad and Tobago, the events following our first case of COVID-19 back in March 2020 have accelerated many of these initiatives. Our presence today at this virtual conference is a sharp reminder of this. So while I am cognizant that we are at different stages of development in relation to technological deployment, I could safely say that this is a road we must all travel on decisively in the near future. However, while we travel along this path, We must ensure that we are fully aware at all times of the risks associated with this fast evolution into a more virtually electronic environment. I'd like to conclude on an optimistic note, hopefully influence in my own way some of the discussion that may follow. In the aftermath of World War II, as he worked towards forming the United Nations, Winston Churchill cautioned us to never let a good crisis go to waste. While I would never categorize all crises as good, I do take to heart what Mr. Churchill meant. If we look past the pain, the suffering, the hardship associated with any crisis, one can see opportunities. In our case, the global pandemic has accelerated many plans to utilize technology in a more meaningful manner. I'm also of the firm belief that this crisis provides us with the opportunity not only to deploy technology in the health and pension sector, but to re-examine these systems. We have a chance to change the products offered or to offer new products that will reach more people. We need to change the traditional structures and the legislation framework to facilitate this active evolution, while at all times ensuring that the most vulnerable in our society are protected. We have the opportunity to implement innovative solutions to not only enhance these systems today, but to ensure they are sustainable and fit for purpose for future generations. Please do have a wonderful and successful webinar. I thank you.
And we thank you very much, Minister, the Honourable Colin Ember, Minister of Finance of the Republic of Trinidad and Tobago. Let's now move on to the presentation of the report, Pensions and Healthcare Systems in Latin America, the Challenges Posed by Aging, Technological Change and Informality. This 2020 report will be presented by Fernando Alvarez, Senior Research Economist of CAF's Socioeconomic Research Directorate. Good morning, Fernando.
Hi, everyone. I hope you can see the presentation right now. Good morning to everyone and welcome to the presentation of our annual report. In this occasion, we work on this very important issue of social protection, but we focus in a particular segment of population, the older adults. Hence, we focus on pensions and health systems. This focus is very relevant for many reasons, but especially because of the fast aging process our countries are about to experience. Certainly, right now, the region is a young region. Only 8% of population is 65 years of older. Of course, there is an important heterogeneity there. Countries like Uruguay, Chile, and Trinidad and Tobago has a larger fraction of older adults. For Trinidad and Tobago, it's 12%. But what it is important is that only in 30 years, the population is expected to double. The population of adults is expected to double. For Trinidad and Tobago, it's going to be 23, and for the region as a whole, it's going to be 18, which is the current level of more developed economies. To have an idea how fast is this process, a similar process took around 1 century in countries like France and Sweden in the past, and here it's only going to take 30 years. Of course, aging is a good news because it represents somehow the improving in health condition of the population, but it has certain implications. Maybe the most obvious implication is the effects on expenditure in pensions and health. As we can see in this figure, the larger the population of older adults, the larger the public expenditure in health and pensions. So we should expect then an increase in those components of public expenditure in the coming years. We can see there, by the way, Trinidad and Tobago in the left panel with expenditure in pension, which is 6.7%, and is above the solid line, suggesting that that is a little higher given the demographic structure of Trinidad and Tobago, which at the end of the day suggests that Trinidad and Tobago has a generous pension system. So it is a first order question to think how our system are going to react, not only to this trend, this demographic trend, but also to some particular challenges that our system have right now. And this is what this book is about. A good way to think about expenditure, about pensions and health system, is to thinking about those elements determining expenditure on one hand and revenues on the other hand. In terms of expenditure, the crucial elements are the coverage and the expenditure per beneficiary, which somehow determine the quality of the protection the system provides. And in terms of the revenues, what is important is the share of contributors, which is importantly affected in the region by informality, but also the rate of contribution. And these two things together determine fiscal sustainability. And what is a good system? A good system is a system that has a large coverage, ideally a universal coverage. It has an adequate expenditure per beneficiary, such that the protection is a good protection, but it also a fiscal sustainable system. And here is where the dilemma arises, because these three elements conflict with each other, in the sense that if we want to increase coverage and we don't do anything else, fiscal sustainability is going to suffer. If we want to increase expenditure per beneficiary and we don't do anything else, again, fiscal sustainability is going to suffer. And if we want to reduce, to bring fiscal sustainability, and this is a major challenge in most of our countries, then we have to think what to do in terms of reducing coverage or changes the targeted population, change expenditure, or work on the revenue side. On top of this, and we know that all of these actions are politically challenging. So those are important issues we have to think when dealing with the protection system. On top of this, we have also to consider that some important contextual issues, contextual elements affects the provision of pensions and health. And in the book, we took very seriously three elements: the demographic trend that I have already talked about, but also informality and technological changes. With this framework on mind, the rest of the presentation is going as follows. First, I will discuss precisely on this element of the labor market, informality and technological change. Then I will briefly characterize pensions and health system in the regions, mostly in three dimensions: coverage, adequacy, and fiscal sustainability. And I will close the presentation discussing a little bit about the challenge coming from rising revenues. So let's start with informality. It is well known that the informality reduces with the GDP per capita of the country. So the richer the country, the less informality there is. What is important is that in our economies, those blue dots there, the informality is larger than what it's suggested by our GDP per capita level. So in that sense, we claim that there exists an excessive informality in our countries. Informality has many implications for the economy, and in particular for the pension and health systems, has at least three implications. The first one is that it reduces the share of contributors relative to older adults. To have an idea how important it is, informality reduces the share of contribution by a magnitude that is similar of 40 years of the next 40 years of aging. So it is a quite big deal. Second, it makes harder the design of the protection system, that now we need to internalize that the provision of the protection, and especially the way we finance such programs, may have effect on the creation of formal jobs. So when we design our system, we have to take that into account, and that restrict the things we can do. And last but not least, it restricts the access to contributor schemes, because those schemes are typically attached to the formality condition, or at least require a minimum level of contributions. To get further in this last point, we need more detailed data that provide information not only of the current status of the worker, but of the whole labor trajectory. This data is difficult to find, but we managed to find the data for a limited number of countries. And we were able to study the labor trajectories of the workers and to simulate the contribution density during the whole working life. And we identified two things. First, that there is an intermittence in contribution where working moving some periods in the formality, other periods in the informality, and that of course reduce the number of total contributions during the working life of the work. To put some number to that idea, here we find that only that 30% of the workers contribute to the system less than 1/4 of the time they are active workers. And only a similar amount, 30% for Brazil or 25% for Ecuador, for instance, contribute to the system 75% of the time they are in the market or longer. So it is easy to anticipate that few workers will reach like 25 or 30 years of contribution, and this is a minimum requirement in some countries. The second issue we deal has to do with the technological change and is related to this automation process, according to which some workers have the risk of loss their work. In particular, those doing routine tasks because they can be substituted by machines. We use the ECAF and a special survey we work on to identify the fraction of workers doing such kind of jobs, and we identify that around 45% of workers in Latin America are in jobs that are intensive in routine tasks, and in that sense are at risk of being displaced or may lose their job. The number for US, for instance, is a little bit lower. It's around 40%, and these workers are most likely workers without college. Of course, this automation hasn't fully developed in the regions, it hasn't arrived yet, but it may come in the future. And what is important is that our labor market institutions must be prepared to the reallocation of the worker and the retrain of the worker that may be displaced by this process. The other issue we deal regarding to technological change has to do with the so-called platforms activity. Think about Uber. Uber is maybe the best example. And this is a phenomenon that is increasing his importance in the region. Actually, this is an important intensity in terms of this phenomenon. Right now, 15% of the labor force is registered as a supplier in a platform, and 9% of the labor force has actually performed a platform activity in the last month. And for most of the workers, this platform activity is the main source of income. So it is a very important phenomenon right now, and for sure, its importance is going to increase in the future. We wonder what is the implication of this sort of job for informality and for the contribution to social systems. And there are different channels that can operate here. One channel is that this technological change can change the fraction of self-employed relative to salary worker, for instance. But it can also happen that it can change the propensity of each particular group to contribute to the systems. In this regard, we find, using our ECAF survey, an interesting and promising results. That is that participate in a platform increases the likelihood of making contribution to Social Security. And this effect is particularly strong for self-employed. One of the hypotheses behind this is that, remember, that lack of contribution to the system may be considered emerged because asymmetric information problem, and the fact that the working is working on a platform that register the activity may reduce, at least from the point of view of the worker, this asymmetric information problem. So we see that this can be a sort of opportunity for the system to bring self-employed toward contribution, but of course the legal framework must exist for the self-employed to do so. Now let's talk a little bit about pensions. Let's start by talking about coverage. In this figure, I show the coverage rate for several countries, and we also include the coverage of the non-contributory systems. What we see is a very heterogeneous situation here. Some countries like Trinidad and Tobago and Bolivia has almost universal coverage. There are some countries like Argentina and Uruguay that has a very large level of coverage. But on the other hand, there are countries like Colombia, Peru, and many Central American countries in which still more than half of our older adults has no access to any sort of pensions. There is also an heterogeneity in terms of the importance of the non-contributory system. For the case of Trinidad and Tobago, and especially for Bolivia, the non-contributory system plays an important role. But in countries like Uruguay and Argentina, the system relies mostly on the contributory system. Of course, behind these patterns, there is the problem of informality, and also the existence or the lack of existence of a mechanism for the self-employed to contribute to the system. The second issue has to do with the adequacy of the pension, in particular the level of the pensions. And here it's important to separate the contributory pension from the non-contributory pensions, because they have different goals. For the case of the non-contributory pensions, a usual goal is poverty alleviation. So a natural benchmark is the poverty line. For comparison purposes, we use the $4 per day as a poverty line, PPP adjusted, of course. And we identify that the Trinidad and Tobago stands out as the country with the largest non-contributory pension, which is almost 8 times this particular poverty line, this particular benchmark. What is important is that there are other countries like Peru and Colombia whose level of pension, non-contributory pensions, is even below this poverty line. So those countries have a challenge in that sense. If we use GDP per capita, same story. Trinidad and Tobago again stands out like a very generous non-contributory pensions. If we consider the minimum wage, again, Trinidad and Tobago is like 130% of the minimum wage. So in this sense, it's clear that Trinidad and Tobago has a very generous non-contributory pension. Regarding to the contributory pensions, it is important here, the benchmark is the previous wage, as the goal of this kind of scheme is to smooth income between the period you are a worker and the period you are a pensioner. So the standard benchmark is the last wage, and in what is called the replacement rate, which is this ratio between the level of the pension and the level of the wage. We estimate that for different countries and different systems, and we find that pay-as-you-go system have a much larger replacement rate than founded system. In fact, in our region, pay-as-you-go system has a larger replacement rates than the replacement rate in more developed economies. And we also find that some founded system like Peru, for example, has a replacement rate that is even below 40%. This 40% is like a normative lower bound suggested by the International Labour Organization. So there are some countries that have some challenges there as well. We also compute the replacement rate for self-employed in those systems when there is a framework for the self-employed to contribute to the Social Security, and it's also high. For the case of Trinidad and Tobago, we find that the minimum replacement rate of the National Insurance Board, which is the standard contributing system, is almost 47%, which is high of this normative level. But if we consider the possibility that the pensioner can also get simultaneously the non-contributory pensions, then the replacement rates are much larger and can be easily 80%. The other side of the coin here is then the financial situations. Currently, most of our economies, or all of our economies, are running deficit. On average, the deficit of the pension system is about 2%, and it's a little bit higher for Trinidad and Tobago, around 3.9%. And what is important is that because of the aging process, this is going to increase dramatically. Just to give you an example, for the case of Trinidad and Tobago, a recent report suggests that only the pensions related to the National Insurance Board will move from a balanced situation right now to a deficit of around 6 points by 2065. This is a major increase, and this only relates to the deficit associated with the National Insurance Board, and does not include, for example, what is related to the non-contributory pensions, for example. Then it is clear that most of our country has to take decisions, to take actions, and of course, the specific mixture of instruments each country is going to use is basically country specific, but there are some general principles. For instance, it is important to introduce a sufficient minimum for everybody. We find that the action actually has a lot of support in the population. According to our surveys, 75% of the population agree or strongly agree with granting a minimum income regardless of how much the people contribute. And it wouldn't cost that much either. We compute that reaching universal coverage through non-contributory pension would cost only 0.24% of GDP on average for the country, and nothing for Trinidad and Tobago because it's already there. And for 2060, it will cost, for 265, it will cost only 0.66%, which is still manageable. Of course, we have to introduce sustainability in our system, because this is the main challenge. The standard instrument there are replacement rates. We know that in some systems, specifically in those pay-as-you-go systems, there is some room there. About contribution rate, I will talk later. A very powerful instrument is the minimum retirement age. It is a standard that in developed countries to retire at 65 years, and in many Latin American countries also to retire at 65 years. But there are some countries in which an early retirement is possible, and this is also a thing that can be revisited, how to manage those early retirement. And according to our simulation, changes in this parameter has a powerful effect on sustainability. Now, let's move to health system. Let's start saying that in the region coexist three schemes. The first one is the private insurance that cover about 4% of older adults. Then we have the social security system, which is the contributory system, which cover around 56% of older adults. What is particularly important in countries like Uruguay, Chile, and Argentina. And then we have the public hospital system, which is free, and in that sense is a non-contributory system. And it covered in the regions around 40% of older adults rely on exclusively on this system, the public hospital system, but it is quite important in countries like Bolivia, Paraguay, Peru, and Mexico, where there is an important labor informality. One important thing here is that there is a fragmentation in the system, in the sense that the kind of services, and especially the quality of services provided by these different schemes differ quite a lot. And in fact, for example, the expenditure per patient in the non-contributory system on average is only half of that in the contributory system, and that translates into a quality gap. The fact that everybody can go to a hospital does not imply that everybody gets the services they need timely and with the required quality. The World Health Organization compute an index, which is the service coverage index, that try to measure coverage in this broader sense. We plot that index in the vertical axis of this graph, and we complement that with a measure of a financial protection in the horizontal axis, which is the percentage of households with medical expenditure above 10%. So it's somehow the lack of protection that we are presenting here. And there, the vertical and the horizontal lines are the average of these two indicators for more developed, for OECD countries. And what we identify is an important gap in terms of the service coverage index, or our countries, the blue dots there are below the horizontal line. Chile and Uruguay are closer. Guatemala and Honduras are very far behind, but most of our country, all of our country are below the level of the more developed economies. In terms of the financial protection, there are some countries like Brazil, Argentina, and Chile where the system provides less protection, but there are some other countries, including Trinidad and Tobago, where that indicator is not bad. We wonder how much would it cost to close this gap relative to the service coverage index. And in order to do so, we perform a frontier analysis, and we identify two things. First, that there is a lot of inefficiency in the way we spend in terms of health expenditure. And two, if we want to close the gap with the current level of efficiency, it would cost a lot. It would cost, on average for the region, 2.5 percentage points of GDP. And a similar value for Trinidad and Tobago, by the way. But here, the main message is that it is not only about spending more, but it is also about spending better. Also, we can close the gap a big deal if, with the same level of expenditure, if we spend much more efficiently. In terms of the financial situation, as in the case of pensions, our system are running deficit right now that on average is 2.4. For Trinidad and Tobago, again, is a little bit higher. And for 2016, for the regions, is going to increase because of aging. The deficit will reach almost 4% of GDP by 2050. Again, there are some reforms here to do. On top of this is important. On top of this, we must consider as well that there's going to be there might be an increase in expenditure associated with long-term care expenditure. In developed countries, many developed countries, the expenditure in long-term care is about 1 point of GDP, and this is fundamentally public spending. So we could expect something coming from this side as well. In terms of the policy guidelines here, first, it is important to increase the integration of the various subsystems and to close the quality gap between them. Here, the introduction of explicit health plans can help. Second, we must improve we must reduce the expenditure or increase the efficiency in the use of resources. Here, the use of co-payment or the adoption of digital technologies can help quite a lot. Prevention policies are important, and we can then promote healthier lifestyle, for example. And last but not least, it is important care policies. We identify that a large, an important fraction of older adults require permanent cares. For instance, in Ecuador, for adults older than 75 years, about 40% of them demand cares, permanent cares. The number for Chile is 20, for Mexico is 30. So it is an important amount. And right now, this is provided fundamentally informally by the household, and especially for our women's, and that can affect women participation in the labor market. So an important policy is to try to institutionalize and formalize the provision of care, long-term services. Now, to finish, I'm going to talk a little bit about the challenges from the revenue side. Just let's recap that the systems are right now running an important deficit, which is about 40.3% for the regions, and will reach almost 8% by 2065. And on top of that, we have to add that some countries must cover quality and coverage gap, must to close quality and coverage gap, and that implies also an expenditure. So we have to do something from the revenue side, and there are only two things that we can do. One is increasing the contribution rate, and in most countries there is no space for doing that, because many of them even has a higher contribution rate than the average for more developed economies. But there are, of course, some exceptions, and Trinidad and Tobago seems to be one of them. In Trinidad and Tobago, the contribution rate, both from employees and from employers, look relatively low in terms of the region, so there is a space for this. Of course, it has to be done very carefully because, as I said before, this can have incidents of informality, and we don't want that. And the final thing we can do is to increase the number of contribution. Here, maybe there are more potential, but it's for sure the most difficult things to do as well. And here we have two possibilities. Either we reduce informality or we increase women participation. To measure that, we have several exercises. Here I show two. One is what we call the formality bonus, in which we reduce informality to the level consistent to our GDP, not to the OECD level, to zero, no, this is much reasonable. To reduce informality to the level consistent with the GDP per capita of that particular country. And then we use this gender bonus, which is what we do here for each group of age and education. We set the participation level in a particular country to the level in OECD countries, but we keep the informality rate of that group in the Latin American country. What we find is the following. The formality bonus is quite important, implies 1%, 1 point of GDP, a permanent increase in around 0.9 point of GDP. But the gender bonus is not quite big, it's actually very small. And what is happening here is that women are participating, but they are participating informally. So this basically reinforces the importance of reducing informality if we want to build a high quality protection system. So this is all. Just to close, let me say all of our country face important challenges in terms of social protection for the elderly, and these require reforms. These reforms need a lot of state capacities, and basically we have to think this social protection in a very broad sense that includes social protection for all age groups. I'm finished here, and I invite you to download our report. So thank you.
Thank you very much for your presentation, Fernando. We'd like to remind our audience, of course, that you can download the presentation, and you can also share your opinion on social media with the hashtag REDCAF. That's hashtag REDCAF. We'll now turn to the panel discussion that will be moderated by Renier Schlieser, Principal Economist at CAF. Good morning, Renier.
Good morning, Wendell. Thank you. It is a pleasure to be here with you today, moderating the panel on this high interest topic for Trinidad and Tobago public policy agenda. I will take a very short time to lay out the structure of the panel. We will have 2 rounds of questions. In each of the rounds, we will direct a question to every one of our panelists. They will have about 5 minutes to address each of the questions. And the first round considers general issues, and the second one is more policy design oriented. So that's the plan. Having said that, I would like to thank all our panelists for being here today, sharing with us all their expertise and knowledge on these very specific issues. We are very proud to have here today Dr. Jennifer Rouse. Dr. Rouse is a gerontologist by profession and lecturer at the University of West Indies. She holds a master's in policy science and a PhD in public policy from University of Maryland, and has extensively studied aging policies in Trinidad and Tobago, and has a long experience both as an academic and as a practitioner on those issues. We also have with us today Maria Daniel. She is a partner in the strategy and transaction practice for Ernst & Young, based in the Trinidad office. She has had an extensive high-profile engagement with the private sector in Trinidad and Tobago and the Caribbean, both developing business plans and models, as well as providing strategic advisory. Maria holds an economics and management degree from University of West Indies. With us today is also Douglas Camacho. Mr. Camacho is the Deputy Chairman of the National Insurance Board of Trinidad and Tobago. He is an accountant by profession with a very long career of leadership experience in the financial sector in Trinidad and Tobago. He currently serves as a chairman in several boards of high-profile financial institutions in the country. And finally, as an international guest, we have Mr. Ignacio Abella. He is an economist for social protection at the World Bank and a professor at the University of Buenos Aires. He has experience on social protection, pension policy, and health economics in many Latin American countries, and has recently published a book on expanding old age income protection coverage in Latin America. He holds a master's degree in economics from the University of Buenos Aires. We welcome you all here today for a lively exchange, and stand ready for learning from all your different perspectives. And let's get to business then. I would like to open this conversation today asking Ignacio, maybe, what are the structural challenges that pensions and health systems are facing across the region, and how has COVID-19, important topic, of course, today, impacted upon those structural challenges? In particularly, we would like to understand the impact in terms of financial sustainability, but also in terms of new or maybe renewed demands in this case. And in which way, Ignacio, should policymakers be thinking about the challenges ahead? Ignacio, the floor is yours.
Thank you, Reina, and good morning, everyone. First of all, I would like to thank CAF for inviting me to be part of this very interesting session as a discussion. I'm glad to see many people discussing about the implication, or better said, the potential implication of the aging process in two very important dimensions, which are not the only one, but are very relevant, such as pension and health system. Second, congratulations, Fernando, and all the team, which was part of this report, not only for the presentation, but also for the very comprehensive report you prepare, and in which I had the pleasure to participate as a kind of reviewer of some chapter in a very early stage of the process. Let me start by mentioning that all the countries in the region are characterized by an extremely low coverage of the pension system, as Fernando pointed out very well. Given the labor market informality, many contributory pension systems don't reach a large number of workers, and as a result, coverage of the working population or active coverage is low, limiting coverage of the elderly as well. Traditionally, pension systems in the region have been characterized by a low active coverage, given the high level of informality. And for this reason, at the beginning of this century, with a favorable international context in terms, basically, of the commodity prices, many countries have implemented non-contributory pension programs. For example, again, Fernando pointed out very well, Trinidad and Tobago is one of the countries with the most generous social program, the Senior Citizens Grant, which is almost universal, integrated to the contributory pension system in terms of the implementation of it, and which allow the country to have an almost 100% of coverage. Other countries, in contrary, have implemented more modest non-contributory pension program. But in any case, given the low coverage, the region has started designing and implementing different strategies to close the gap. Having said that, the first thing we have to consider, and it was very well, again, pointed out in the report and by Fernando, is that the region is going through its demographic transition to an aging population. Which is good news. I mean, population aging is the result of a reduction in mortality, which means an increase in the life expectancy, and also in a reduction in the fertility rate, resulting from families being able to control the number of children they really have, and allow women to increase their role in non-domestic activities. These two trends clearly reflect long-term improvement in welfare and economic and social development, and they should be welcome. However, this process also entails policy challenges. Many public institutions, including education, health, long-term care, of course, pension system, and also labor market regulation, are designed for a different demographic context, and thus need to be adapted to be effective in this new scenario. So, going to the question, I would like to mention something that I assume it is common knowledge, but it's important. Population aging leads to two different public policy challenges. On one hand, older population demand more fiscal resources for social services such as health, pension, long-term care, etc. But on the other hand, and this is a point that it is not usually mentioned, aging process reduce, or better said, produce a shift in the proportion of the working age population that may affect long-term economic growth. So pension system plays a double role in the population aging debate. On the one hand, there is a clear financial aspect because more elderly people imply more resources necessary to finance their daily living. However, and A second and equally important aspect related to the first and second dividend and the macroeconomic impacts of aging. As population get older, the size of the labor force tends to decline and dependency rate grow. If pension systems promote early retirement and limit the participation of older people in the labor market, the pension systems, will be not only expensive, but also it will be a constraint for economic growth, and therefore there would be a reduction.
I think we are experiencing a little bit of a trouble with the connection from Ignacio Apella. While we get him back to finish his remarks, I would like to take advantage of something he was mentioning.
The sequence estimate of
he's back. So
I'm sorry.
We are going back to Ignacio. We lost
you
for yeah, we can listen to you now. We lost you for about 30 seconds.
Okay, I was talking about COVID-19. You hear that? Okay, I was saying that that from my point of view, it's still too early to draw conclusion about the impact of the COVID on pension system, and it will depend on whether it is a temporary or a permanent situation. But of course, estimate of life expectancy for this year tend to decline, but it should not modify the long-term demographic trends. One of the biggest concerns that the pandemic brought is in terms of the labor market, and it is particularly the loss of jobs. Some initiatives that are being implemented in countries, particularly with full funded schemes, such as Chile and Mexico, is to allow workers who are an employee to withdraw funds in advance from their individual accounts. And I think that this initiative, of course, this allows to reduce the incidence of poverty now, but it will probably have an impact on the future replacement rate. But this is a trade-off, and you know, the art of politics is managing trade-off. So how should we think a reform of the pension system? Population aging is gradual, but it is a certain process. Countries in the region need to adapt their institution to make their pension system more effective in this new demographic scenario. Although aging impact will be seen in the mid and long term, policy reforms are urgent. On the one hand, because reforms take time, I mean, in terms of the design and implementation, and also because it's in any pension reform, it's important to build a political and social consensus. And on the other hand, because today workers will be part of the elderly population after, let's say, 2015, their current decisions are conditioned by the existing rule of the game. In other words, the decisions people take throughout their labor history are framed by current and future social economic institutions. In most cases, the political reality requires a long period of transition before a new regulatory framework becomes fully effective. If a necessary reform is put off, the need for it will intensify and its implementation will become more dramatic. You know? So the cost of existing system is likely to keep rising the entire transition period before a reform stabilizing effects set in. So because the demographic transition is not completed in the region, now is the time to start designing medium and long-term strategies to strengthen pension system while hitting each country's specific social, economic, fiscal, and demographic realities. In this sense, it's important to identify, first of all, mechanisms that extend the active life of workers, increasing their productivity and consequently generating resources to finance pension systems. So it's important to start thinking on how to promote an increase in the retirement age. Some countries prefer to increase the minimum legal retirement age. Of course, this implies some political costs. So from my point of view, we need to identify mechanisms that provide incentives for voluntary behavioral changes and incentivize workers to postpone voluntarily their retirement. On the other hand, and this is another very important point from my point of view, is the use of general revenues. I mean, those which come from the Treasury to finance contributory schemes in a context of labor informality and low contributory coverage. The current contributory design of most pension systems in the region establishes minimum contributory periods for being eligible. But most workers perform activities during significant periods in the informal sector, and they may not be eligible for benefit at retirement age, even in the case when they have made significant contributions in the past. In contexts in which transition between informal and formal employment is common, a more flexible model that combines a basic universal or social pension with contributory plans that recognize past contribution without setting minimum contributory periods and a voluntary long-term saving plans will probably be more equitable. In this sense, and something that Fernando mentioned in his presentation, of course, fiscal or actuarial sustainability is important, and we can do something on it. But I would like to put on the table as a kind of kickoff to start thinking about it, this concept, which is the economic sustainability. Given that system will demand more and more fiscal resources, I mean general revenues, to finance the contributory system, I think that the most important concept here is this one, the economic sustainability of the system, which means how many points of the GDP countries are willing to allocate for the payment of pensions. In my opinion, and in summary, these are the two most important things to take in consideration when we want to think about a pension reform. The first one is, how to promote a postponement in the retirement age, not only to address the fiscal impact of the aging, but also to increase the size of the labor force in an aging context. And the second one, and given the high level of informality in the region and the low density of contribution, it is important to start thinking about the incorporation of a basic pillar in order to reduce the horizontal inequality generated from the use of general revenues to finance the contributory scheme. I will stop here and over to you.
Excellent, Ignacio. Ignacio mentioned a challenge, a very relevant challenge posed by the aging process, and taking advantage of having here Dr. Rouse. Now, I would like to turn a bit more specific into dimensions, both in terms of focus on health and elderly care, but also to look more into detail the case of Trinidad and Tobago. Dr. Rouse, could you please discuss a bit the demographic trends that we are observing right now in the country, and help us understand what do they mean in terms of health provision and elderly care in the future? In specific, how different would the sickness profile be in years to come, and what implications will it have on the supply of health services? There are many questions here, and I apologize for this, but this is a very important topic. Also, I would like to know what challenges would the country need to face to adapt to higher demand for elderly care, And maybe we can look into other experiences in the Caribbean, where countries are far ahead in this demographic process to illustrate what is going to happen in Trinidad and Tobago. Go ahead, Dr. Rouse, please.
And a pleasant morning to the Honourable Minister of Finance, Ember, and my fellow panelists. Also, and I hope my audio is clear, all of you hearing me, because I am hearing myself as well, and all is well. So let me cut straight to the chase. Now, we have to establish that Trinidad and Tobago is an aging population. They have 3 factors that are responsible for that. That's low fertility, low mortality rates, and net migration, because that is critical because we have immigrants and we have immigrants. Now, what has happened in terms of the demographic part of it, because we have to have the context. The last census that was done in 2010 showed that 13.4% of the total population at the time was 1.3 million. Was 13.4% in bodies meant about approximately 177,676 persons that were aged 60 and over, because we are using 60 years as the baseline age to define an older person. Now, what is the indicator to let us know that we are an aging population is once you are 10% or more of your total population that is 60 and over, then you are an aging population. So in 2010, when our statistics showed 13.4%, what we had at the time was a trajectory from UN DESA, that is the Department of Economic and Social Affairs, telling us that by 2030, we would be looking at 17.5% of our total population, which will be 60 years and over. Now, having had the pandemic start last year, which would have been the year to do the next census because they are done every 10 years, that didn't happen. So to get a realistic trajectory of how we will move from 2010 at 13.4 to 2030 at 17.5, what I did was estimate adding on 1% in a 5-year range. So from 2010 to 2015, and we add on 1, we would be then 14.4. And then we add on from 2015 to 2020, we would be 15.4. So now we are in 2021. So we are now within that range between 2021 and 2025, where we should be looking at about 16.4% of our total population, which in numbers is about 230,000 persons that are aged 60 years and over. That is a significant amount of older persons. And so now that we have the context, because that figure, if it stays as it is with our population now 1.4 million, then when we reach 17.5% at 2030, we are looking at about roughly 245,000 persons, older persons who are 60 and over. Now, the context, to put that in the context of, as you asked, in terms of health provision and elder care, we have roughly 190 to 195 homes for the aged, largely in Trinidad and Tobago. Trinidad, because Tobago culture is slightly different to us when it comes to institutionalizing their older persons. So even though it may sound like 190, 195 homes, collectively, the residents, the head count, only amounts to roughly 2,005 plus. And that is about 1% of the population that is aged. So it means 99% of our seniors live in the community, as a result of which we are looking at females, again, as was said before, being the de facto caregivers and the family being the first place of taking care of these relatives. But we have also heard, on the other hand, that families have shrunk. So there has been dynamic shifts being made in the family structure, where you have now moving from the extended family to the nuclear and even single-headed families, as a result of which that sharing of caregiving is now challenged, because you have less persons in a family to share that between, and it is left up to one or two persons, which is now what they're calling the burden of care, which I find pejorative, and I don't use the word burden, but that is the reality. Also, we still have where the female is the de facto caregiver in the family structure. But yet, what we are seeing, the optic is showing us on the university campuses that there's a huge overrepresentation of females that are there. So they are leaving the house to get, well, for upward social mobility and to become more qualified, etc. That now is one part of the equation. And then you also, so that coupled with the family structure having changed, has left now our seniors without that inbuilt automatic taken for granted caregivers within the household. So it automatically showed that there is now an increasing demand for home care. Because even though we have those 190 or 95 homes, the culture is not yet there where they automatically just shift their older persons, as in the developing countries, to an institutionalized setting. So now that that demand is there, what do we see in terms of now that the elderly population is growing commensurate with this demand? We find now where there's a dearth of agencies providing trained caregivers, as well as adult daycare and senior centers, where at least they can be occupied during the day, if even they had adult children who are working, which is more often than not. So also what we have, and we see, there's a huge demand on the state program called the Geriatric Adolescent Partnership Program, the acronym GAP, which used to be housed under the Ministry of Community Development and then Social Development. That has now moved to another ministry. However, they have a quota that they train of 600, and that's the cap. And those potential caregivers are between the ages of 17 to 35. However, when you speak with the older persons themselves, especially the oldest old category, with those who are over 85, they prefer older and more mature caregivers seeing about them. Somebody that is in the 40s and 50s. So that is one gap that we are finding. Also, what we tend to shun or not pay attention to is the whole question of male caregivers. So it is so automatic that we look to the female. We also have a catchment of males who are the adult sons or sons-in-law that are very good caregivers, but it is because maybe of the macho image. Why are you going in to do caregiving and nursing and these softer issues? It's a question to be asked. So what we should also understand, and I think it was mentioned, that pension, which is a fixed income, tends to be, for the majority of our seniors, that's their only source of income. And it is fixed. And we have a situation now where we are seeing a considerable number of our grandparents who are parenting. And so even though, so that puts a burden, if you want to use the word, on them also, because out of this fixed income, and who are they parenting? They are parenting children of their migrant adult children who emigrated years ago. We're also looking at children of persons who are afflicted with HIV/AIDS. We're also looking at children who are from those who are incarcerated, as well as drug abusers. And then we have teenage pregnancies. So the household, what is happening inside the household is totally different. And in some instances, we even have multi-generational families because now the grandmother is no longer silver here and 80 and 85. We have grandparents now who are 30 and 35. So that is a whole area that is for another discussion. So now when we see now that context and we look at your second question, how different would the sickness profile be in years to come, and what implications will it have on the supply of health services? Clearly, if drastic changes are not made to lifestyles from now, and this pandemic has shown that clearly, because most, if not all, of the fatalities that we are having for our seniors in this pandemic, you only hear the term with comorbidities, underlying health issues. So it means we have to relook at how we define not only health, but look at the more wellness and well-being aspect of how we treat with health. So if current trends continue and with this sickness profile, what we have to look at in changing lifestyles is looking at diet and looking at that critical work-life balance, or maybe I should say work-life imbalance, because what we are seeing that the pandemic has really underscored it, of a point I was going to make. But I had been at a conference some years ago, and we had flagged that age cohort between 20 and 49 were now afflicted with renal failure and kidney problems. And we never heard that for such young people. That used to be considered an old person's sickness. However, what now has happened in the pandemic deaths, because we have weekly COVID press conferences, initially the fatalities were the elderly, which were those 60 and over. But over the last 3 weeks, we have seen now a shift where the increasing amount of deaths are between 20 to 49 and equal in gender, both male and female. So this is a clear signal that has now underscored what we had seen some years ago with what is happening with this younger cohort getting comorbidities at such a young age. Now, what the epidemiologists said at that conference was what they have recognized is that what has been happening slowly but subliminally is that the rate at which change is happening and occurring, and we're talking whether it be climate change or technological advances, it is too fast for the human psyche, and it is affecting younger people at a cellular level if they have to keep up with the rate at which change is happening. And remember too, this is the age cohort that most of them are employed in contract work, which is very portable and transient. So with it was a conference that was held with Republic Bank and Business Development Center some years ago, showing that this is the first time in the history of the world that we have 5 generations that are living together at the same time. So here we have contract work, which is not age-based, but skills-based. And you have it in the workplace where 5 generations are together. And then you have outside what this is causing. So that very same conference showed that in the working life, from maybe 18 to 59, the millennials are going to work in approximately 20 different kinds of jobs. And so they are constantly on moving and retooling and re-engineering. And this is having an impact at a cellular level. And as a result of which, this is now showing itself with the pandemic in the face of comorbidities which they are juggling with. And so what that means is that there is a disconnect, and this is what I heard from a recent medical doctor who is into integrative holistic health, that because of the pace at which we are living and working and juggling so many roles simultaneously, what we have done is disconnected the rhythm that we should have with nature, because nature works in a rhythm, and it works, it is very disciplined and systematic, but we have fractured that. And we know, of course, with ad nauseum, all the destruction that we have done to the environment. And so the pandemic is not just one-off, there are more to come. So now we have to look at what this has been causing now, because it is now at a deeper cellular level and affecting now the psyche and the psychological part of these younger people. It is now leading to mental illness. So we are seeing now that mental illness and loneliness, which is something you never heard a young person speaking about, being bored and how boring life is, but that is out there. And so that emptiness and wondering what maybe is their raison d'etre is now exploding in the form of healthcare and comorbidities. And just accidentally, I happened to listen to one of the interviews on 60 Minutes last week, Sunday. And what the scientists have realized who are studying longevity, because we are in a longevity revolution, as Professor Butler wrote, what they are seeing now is that in this revolutionary trend of the whole aging question, is that the whole mental illness, the trajectories that are being made, we have to now look at, when you are even interviewing persons, to be looking for psychometric testing, to be knowing what is sanity versus insanity. We have to go that far and getting the indicators that would help us there.
Dr. Rouse,
also,
we are going to get back later to some of these issues,
yes,
but I wanted to take advantage of what you were mentioning about the demographic trends,
yes,
go a little bit into another direction that is also of a lot of interest, like Fernando Alvarez was mentioning at the beginning. As was mentioned before, and the trends you were describing, financial sustainability is going to be a very relevant challenge for the pensions and both health pensions and healthcare systems in the region. In the case of Trinidad and Tobago, according to the 10th actuarial review of 2016, there is a contingent financial gap in the system that is equivalent to 80% of GDP for the next 50 years. And I would like to get two different perspectives on this question. One maybe from Mr. Camacho from the National Insurance Board, and then have Maria Daniel give us a perspective from the private sector. I'm going to stress a little bit where I want to go the discussion to go. As the report proposes, there seems to be a little fiscal space in Trinidad and Tobago, and it's not even clear that we would like the financing gap to go through the general taxation process. So we are here somewhat between a rock and a hard place. What do we do? Do we lower benefits? Do we increase contributions? Fernando stressed out very clearly what the options in general are, but he also said that that there is a political side to taking these decisions. So again, I would like to have the two perspectives here.
Sure.
From the standpoint of the National Insurance Board, and also from the point of view of the private sector. What are the options and what are the costs of making those choices now? So maybe we can start with Mr. Camacho. I'll give him the floor now. Thank you.
Thank you very much, Renia. I'll try to keep my timeline within the 5 minutes because I realize the clock is ticking. So thank you all for having me here to represent the National Insurance Board, but more importantly, I think to speak to this very important subject that goes beyond just Trinidad and Tobago, but the wider region of the Americas. Let me say that there's no one answer and there's no panacea to solve all the evils here. We will always have the constant dynamic of the social, the political, the financial, pulling and tugging to try and find some means to navigate between them and among them to come to a landing that makes sense. And I think it requires a combination of solutions to arrive at a place which will make, one, the fund sustainable for the future, and two, to deliver on the needs of the population at large, and in particular here in Trinidad and Tobago. So I want to touch on some of the key areas that have been mentioned along the way by different speakers. And I will start with the issue of aging, which is the hot button thing and one of the drivers for a lot of the challenges we face. The National Insurance Act of Trinidad and Tobago actually defines the retirement age as 65, interestingly enough. But however, allowance over time has been given for people to retire at age 60, and very untraditional to insurance plans allow that without the corresponding reduction in the pension that a person will be granted at that particular point in time. So whether you went at 60 or 65, you're granted a full pension. The second dynamic that is important to note is that a minimum pension figure has been determined, and that particular figure at the moment stands at TT dollars 3,000. What that has resulted in is, in fact, of the 108 odd thousand pensioners actually being in receipt of pensions at this point in time, a subsidy is given to well over 80-something% of those pensioners. So what you have is a fund subsidizing 80% of the beneficiaries at this particular point in time. One of the possible solutions for that is to freeze the minimum pension at the 3,000 until it reaches a point as recommended in the actual valuation and mentioned by the Honourable Minister in his keynote address earlier this morning, of 80% of the minimum wage. Current minimum wage being, say, 3,000 in Trinidad, and traditionally in pensions, one ought to be able to live off the percentage of the minimum wage, and the ILO and others have identified that as, say, 80%. So that is one possibility. Now, it is not likely that it's politically, socially, or otherwise acceptable to reduce the pensions to accommodate that outcome. So what we have recommended, certainly at the level of the NIB, is that we freeze the pension until such time as that 80% trigger is arrived at. And thereafter, we adjust the pensions, that minimum pension, to consistently be in line with the minimum of 80% of the minimum wage. So that is one option. The other option is, of course, much touted, to actually formalize the retirement age of 65 and only pay the full pension at age 65. Again, that is probably something that will require management over time and not something that one could introduce in the morning without serious consequences. I think it's under consideration now by the government of Trinidad and Tobago, and I think it is one that realistically we all have to accept is inevitable. It is just how and when. And I think what the NIB has proposed is that we transition it over the next couple of years to get to 65 in the first instance, and that we keep reviewing it and then realistically decide, do we stay at 65 or do we gradually over time adjust as we keep speaking about the longevity? And in fact, it's not just longevity, but the fact that people at older ages are still very capable of being productive to the society. Another area only mentioned sometimes in passing is I call it the widening of the net from whom we could collect revenue and ultimately pay pensions to. I think I heard it referred to, and in this document put out by the CAF, as that informal sector, the sector that does not quite get captured in the existing structure of the current scheme in Trinidad and Tobago. And I think if we could broaden the net, in the first instance, it will have a cost, no question about that, because there isn't the short time. If everyone were to join tomorrow for the ones close to retirement, and with a minimum pension being what it is, of having sufficient accrued value. But it is certainly a solution that the sooner we start it, the better we'll be off. And it will take time for it to fully have the impact. But as we look to the medium and long term sustainability of the fund, it ultimately will come to the fore. Another choice that has never been really touted is, if we are to subsidize pensions, from where should that subsidy come? Historically, people have always looked to the state as the sort of bank of last resort or the source of subsidy. But I think in this day and age, a lot more creative solutions could perhaps be developed, which would encourage perhaps public-private sector, labor-type joint partnerships, because it is in everyone's interest to ensure the future of those who will ultimately reach that age. And as we have been hearing from all the speakers, an ever-increasing number with an ever, relatively speaking, decreasing number of people who will actually contribute to those who will have an ever-increasing longer lifespan to be contributed towards. And just so that I don't run too far and I give Maria a chance to really jump into this fray, I would like to say as well that a much touted possible solution that would help smooth things over a bit is the harmonization of private pension plans with the public pension plan system. At the moment here in Trinidad and Tobago, there is not a formal structure for harmonization. And just simplistically speaking, if one were to take the public pension system as your base, and then layer on top of that the private pension funds as top-ups, I think it would start to alleviate some of the future problems and burden that the state could have. And lastly, I know we're going to get into it perhaps in another part of the program, but the whole way of doing business is changing. The whole ethos where people prior years look to get into a job and spend their life in the job, or may have had 2 jobs in their whole working career. Well, the young people seem to think, and the modern world seems to be, that if you're more than 3 years in a job, something is wrong with you. And certainly if you're 5 years, you must be stuck in a rut. And while I'm not going to pronounce on that, because I'm certainly not a sociologist, and there are those who are much more qualified than I to speak to that, but that is a reality of the workforce of today, where there's a lot of mobility. And I do think that the solutions have got to embrace that reality. And how do we keep those people in the programs engaged in a structure that could accommodate their needs and meet their needs? If we can't find quick solutions to that, even if they take a while to be implemented, I think we will be exacerbating what is already a pretty dire situation for us, and I'm sure for other social pension plans around the world. I'll close there and give Maria an opportunity now to come in, because I know time is ticking. Thank you.
Thanks, Douglas. Good morning, everyone. So in the interest of time, because I share more or less most of the views that Douglas brought out there, so I'll just expand it a little way from the private sector perspective. And maybe I could headway from what Douglas ended there with. which is a real problem in that we have these millennials who really have different value systems, different wants, different needs. You're talking about 3 years. I think in 9 months, if they don't think that they've learned everything that they can learn in a lifetime, they're not learning anything. I often have to remind them that I'm 50 years and I might know a little more than they do. So, but the way the pension system right now, in the private sector is, a 5-year minimum. And if you leave within that 5 years, your contributions are then returned. Most of these young people are not going to use that money to put it in their own pension fund. So what we have is that if they keep moving, that pool of funds are of course going to be lost. So I think one of the suggestions that Douglas had there that I think is really important is the whole meshing of the systems, the public and the private sector. And one thing we also have to look at from that perspective, which no one has really touched in a big way, and which was highlighted in the actuarial report, is this whole thing of the investment income of the fund and maximizing these returns, and even looking at how do we even build a circular investment scheme? And what do I mean by that? So you have the same pensions that have to invest in long-term assets for long-term liabilities. How can we invest in the needs that Jennifer was talking about, which is assisted programs? And how can you earn revenue from that and then goes back into the pension system? So I think for us to solve this problem is, as Douglas said, it clearly is not one solution. Just like politics, it's a balance. So if we say, okay, everybody, and I know most 60-year-olds, I'm reaching that age too, where a lot of people reaching 60 that I know, and they're like, but I feel like I'm in my peak. What am I going to do? But you also have to leave room, like in our organization, we have to get out so the younger ones can take over. So it's how do you balance that, but give people an earning where they can now subsidize these pensions? As Douglas mentioned, you have that $3,000. What can we do now to create jobs for the 60 plus that will help them? They don't have to work full time. Nobody want to work full time forever. They don't have to work full time, but they can enhance that government pension or grant. And the other thing I will mention is, the whole thing is an ecosystem. So if we even look at real estate, which is your first big investment, and why is that important? What are the banks are now doing to make this affordable is they are extending the terms beyond the 60 and the 65, and some banks are going to 70. So what does that say? The disposable income that you would have on retirement to live off of is now also still going to your mortgage. So I think some of these solutions we have to get is really out of the box, bring the financial literacy. The Honourable Minister mentioned that, and I don't think we pay enough attention. If we build more individual wealth, then the need to be on a government pension will be less. So we have to look at our capital market, which is very far from being developed, where people can be not just getting financial literacy, but have access to investments. So I really think a big part of this puzzle, and I'll close with there, as one of the solutions, is how do we build that entire capital market where people could be more involved in investing their own wealth for the future. So I'll just end it there looking at the time.
Thank you very much. Very clear perspectives. Before we go into the policy design round, I would like to go very quickly, 2 minutes, please, back to Ignacio regarding an issue that was discussed briefly before. Fernando mentioned the gender and formality dividends, and he said, well, at least the formality dividend is significant. The gender one might be in the case of Trinidad, given low female participation. But I wanted to ask a little bit of what can we do, what can countries do to get the most out of these potential dividends, and also mention the question about migration that might be also a potential source of a dividend, in particular now for Trinidad and Tobago that has become a net receiver of migrants. Ignacio, 2 minutes.
Okay, can you hear me well?
Yes.
Oh, okay. Well, this is a very relevant point, if not the most, to be considered when we talk about the implication of the aging process in our country. As I mentioned before, the aging process implies a potential increase in the expenditure associated with pension and health, but it also implies a decrease in the size of the labor force. And therefore, it constitutes a constraint to maintain the economic growth in the long term. In this sense, one of the challenges faced by the countries in the region is to maintain a sustained growth rate of the GDP per capita once the aging stage has been reached. No? I had a professor who used to say that the challenge for Latin America is to get rich before it gets old. And I think that it was right? The effect of the demographic transition on the economic growth process are related to what we usually call the first and second demographic dividend. And this is the point here. Before reaching the aging stage, countries have a great opportunity defined by the demographic bonus or first dividend. This bonus is the current period in which the share of working age population and population with saving capacity in the total population is at its highest level, let's say. And this constitutes, a great opportunity in the short term as countries reach their maximum labor force level, which results in increasing the GDP and potential saving. During this bonus, there are favorable conditions to boost economic growth. Now, this first dividend disappears when the aging stage starts, as the share of the dependent in the total population begins to increase. So the first dividend is a transitory phenomenon, and we need to have it clear. The second demographic dividend takes place because there is an increase in the share of the population that can be considered as prime savers during this first dividend period. This situation could lead to an increase in the economic saving rate, which can be used to increase investment in physical and human capital per worker, and thus increase productivity once the aging stage has been reached. As a result, the second dividend produces long-term benefits through a sustainable economy. Demographic transition is far from being a neutral process regarding the dynamic economic growth. The absence of neutrality is associated precisely with these two dividends. The first one affects the labor factor endowment, leading to conditions that favor economic expansion during the first dividend. In turn, the second dividend acts on the saving condition of the economy, affecting the capacity to invest and accumulate physical and human capital, as well as the total factor productivity. What we are seeing in the region is that although the first dividend has a significant contribution to the current economic growth, we are not taking advantage of it given the extremely low saving and investment rate. So it seems that there is a risk of not materializing the second dividend. The dividend mentioned here, such as gender and migration, also informality dividends, are very important because they allow countries to increase the size of the labor force and therefore to extend the demographic bonus and maybe gain time to materialize the second dividend. However, their effects are transitory because they only change the level of the curve. I mean, in this case, the size of the labor force, but not its strength. As I usually say, demographic always wins. So how we can take advantage of these dividends? In terms of the gender dividends, to achieve higher female labor participation, public policies should focus on narrowing gaps in access and compensation. Generally speaking, although female labor participation has increased in the last 20 years, it's much lower than the male rate. In medium and high-income countries in Europe and East Asia, for example, public policies aimed at increasing female participation promote a better balance between work and family needs. Family care needs are an important factor that limits the labor participation of women. For that reason, it's important to encourage paid paternity leaves and provide childcare options. Additionally, but in the same sense, the organization of a care system may generate free time for a large share of women and allow a greater labor participation. A recent analysis carried out by the World Bank on population aging trends in the East Asian countries shows, for example, that the benefits of initiatives that could free up household time for caregivers to work in a paid occupation are double. On the one hand, women with talent, skills, and interests, of course, could perform tasks they are interested in, and on the other, it could generate demand, let's say, for household caregiving services in the market. So it is a way to monetize, if you want, a service which generally is non-paid work performed by women in their houses. In some countries such as Spain, Germany, and the particular case of Quebec in Canada, there is a significant and positive correlation between the in Uruguay, for example, the World Bank and the National Social Security Institute, BPS, a pilot of a paternity leave in order to understand the effect of it on the female labor participation. And regarding the migration dividend, this is another important dimension because it affects the population structure, especially currently in Latin America and the Caribbean, of course, with more emphasis in some countries than others, but it's very important. In demographic context that tend to reduce the size of the labor force in the mid and long term, not only immigration, but also its characteristics would allow to expand the labor force, and thus the duration of the demographic bonus. In this sense, although it is the demographic behavior that establishes the boundaries of the window of opportunity, the incorporation of new migration flows to the labor force will endow it with certain, let's say, flexibility. It is strategically important to establish mechanisms to foster immigration to the country without depending on, external factors such as the economic or political crisis that may take place in the rest of the world. I like a lot a recent example in Chile. The country constitutes a register of migrants who wish to emigrate to Chile, in which people must state their demographic characteristics, but also their skill and knowledge. In this way, the country promotes immigration and allow them, allow migrants easy residence, but locating immigrants in those areas where their skills are necessary for the productive sector. Of course, all these policies are important to increase the size of the labor force and therefore to extend the first dividend. But again, we need to have clear that the demographic always win, and it is important to promote a higher saving and investment rate in order to increase the productivity of the economy and materialize the second dividend. So I will stop here. Over to you.
Thank you, Ignacio. Now, I would like to finish this panel with a round center on policy design from different perspectives. We are going to let Douglas Camacho start this round with two very relevant policy design issues. The first one is relevant everywhere and certainly relevant for Trinidad and Tobago, and it's about how to achieve long-term sustainability. The second one, and I apologize already for hitting you with two tough questions, and in compensation, I will give you 4 minutes in 2 minutes. I would like your thoughts on the potential integration of sovereign funds and pension systems as a way smooth out income risks. Of course, what I have in mind here is how could the potential reform to the Heritage and Stabilization Fund in Trinidad and Tobago interact with social protection policy design? Please, Mr. Camacho.
Thank you very much. I'll try to wrap it all up so that the two are entwined. I think it goes again to the heart, that last bit about the way we could harmonize. And the Heritage and Stabilization Fund that you mentioned is but one of the possible tools that one could utilize in the armory of solutions to meet this need. I mentioned earlier about we have to think differently about how do we create that fund? How do we finance, for instance, the subsidy that is intended for those who are most in need and most at risk? And I mentioned that in the current construct, it is assumed that the state will bear directly on its own. And I was suggesting that there's a need for a tripartite type approach, labor, business, government, to find solutions. And I think the Heritage and Stabilization Fund is but a fund which I think would allow a source of, if you like, revenue to be utilized to help create that capability. The other element which deals with, as I mentioned, the harmonization of private and public sector funds, I think needs to be expanded even wider to incorporate those non-contributory type solutions that the government of Trinidad and Tobago provides via its social development ministry, where people do collect on a pension, and to try and ensure that there isn't, I guess the word that I would like to use here would be to ensure that there isn't a double dipping taking place, where people collect that and then at the same time are collecting either a private pension and or a state pension through the National Insurance Board without declaring it, and therefore double or triple dipping as the case may be. So finding mechanisms to deal with that. Another critical element is that widening of the net that I spoke about. I think it is imperative. It is imperative for us to ensure that all the working population, whether through formal, informal, employed, self-employed, cottage industries, etc. One of the speakers even mentioned the so-called unpaid work of the caregivers who stay at home and look after people, that we have got to find a way to capture and bring into the net all of those, both from the perspective of contributing to, as well as the perspective of earning at the back end as it comes out of the pension. So I think that there is no panacea, as I mentioned at my earlier commentary for this, but I do think that we have to be creative. Two of the underpinning things I would like to mention. One, and the first one, is that financial literacy and financial education that needs to be broadened and deepened. I know the CBTT and other institutions have spent time, Unit Trust comes to mind, and other banks and others, insurance companies, have spent some time in trying to educate the public on the issue of financial literacy. But I think it's got to find its way into the curriculum. It's got to be part of the training of people from the school level right the way up. So the first thing I think is educating people to that. And I want to close by saying at the end of the day, it is about personal responsibility. It is one that we tend to often make excuses for. We excuse ourselves, we excuse others, we find reasons why people can't, or they don't know better, and we find all kinds of reasons why. But I do think if we are to come with a solution that is sustainable and has a long-term chance of success, everyone, I stress, has got to start taking personal responsibility and not leaving it up to anyone else, be it the state or otherwise. So with those remarks, I think I've stayed within my 4 minutes or just thereabouts.
Thank you.
I will now hand back over.
Excellent. Maria, in talking before about policies to increase female participation and formalization. I would like to ask you a question that is related to that. All these policy design issues will have an impact on labor costs and international competitiveness for the private sector. We know this is a very relevant topic for Trinidad and Tobago, especially in their quest for economic diversification. So I would like to get your thoughts on these specific issues and how these issues affect or should be reflected in the policy design of the reform, pension reform.
I think when we look at pension design, and I want to tie in the comments made by both Douglas and Ignacio, in that we have to use technology. Where I see everything, the solution being, and in the 2 minutes, this is what I would say. If we had a technology that could bring together the systems, also track who is in and who is out, and also make that financial inclusion easier. So bringing the individuals, the women who are, most of them are self-employed. I would say in Trinidad and Tobago, you have a large portion of food is a big thing in Trinidad, of individuals providing food, and all these things are not under the net right now. But what we need is a technology and a pension design that makes mobility, makes registration, makes receiving your benefits even easier. So we want to do that without, of course, as you said, increasing our labor costs. And the only way we can do that for it to be efficient for companies and for individuals to come on board is to make it very easy. And then if we're able to even digitize, and Douglas are throwing this one at you, the core NIB, so that we can bring down that administrative cost to some extent, then again, the contributions are going to go even further. So I think about when we talk about competitiveness, competitiveness is making ourselves more efficient. And the solution I see there is to bring technology to play, which can also, as Douglas kind of implied, you don't have people double dipping because everybody will have one unique ID and we know where everybody's getting their pension from. And then again, the entire system will be more efficient. Once we are able to reduce that cost, our contributions can go further. And even we may not have to increase contributions to meet the benefits that we want to do. So I will close on that. I think pension design has to take a complete new look. We have to look at the changing workforce, the mix of female and male. I would say in Trinidad, we don't have as much of a disparity, I think, as in Latin America. And we have to ensure that we bring it all together. Otherwise, the deficits that they are forecasting right now are going to become a reality.
Thank you, Maria. Little time left, but I wanted to ask if you have any further comment about pension design and impact on formalization and labor participation. Maybe 1 minute.
No, just very brief. The impact of pension design is a widely debated topic, but international experience doesn't show significant impact on formality from the pension design, because labor formality depends on many, but especially on the productivity economy, generally speaking, and on the firm's productivity in particular. Fernando showed a graph in which there was a negative and significant correlation between informality rate and GDP per capita. So I think that there is partially an answer. But for example, the debate tends to focus, for example, on the contribution rate and in its impact on formalization. Of course, high contribution rate increase the labor cost and therefore encourage less formality. But here, again, the problem is not the contribution rate. The problem is the level of productivity of the firm. Of course, this doesn't affect all firms equally, and in some cases, there can be some clear effects. But I give you an example. In Mexico, last year, a reform of the pension system was approved, which includes, among other changes, an increase in the contribution rate. And this was motivated by the low replacement rate that the system good ground in the future, since the contribution was very, very low. Something similar happened in Chile a few years ago. On the contrary, in Argentina, government has reduced the contribution rate in different periods of the history because the country wanted to reduce labor costs and increase formal employment. However, results don't show a direct impact on these dimensions. So what I mean is that labor formality depends on more structural factors of the economy, such as productivity, and also, of course, on the state capacity to enforce labor regulation and to much lesser extent the design of the pension system. Over to you.
Thank you, Ignacio. Now, for 2 minutes, back to Dr. Rouse to ask for a few issues on successful design of social protection schemes, taking into account the demographic and health profiles we were talking about before. Thank you.
I love both Douglas and Maria's contribution. They endorsed totally what I had listed. Douglas, you were on point. Maria, you as well. So I'll be straight up. My key thing is current senior citizens pension or grant, which is now being paid to the informal networks. There is no structure or formula as to the computation of that quantum. And so it was my belief that there should be like a quality of life index, just how the central bank uses HDI and so to determine the poverty line. We need to have a quality of life index so that you can explain to a pensioner, how did you arrive at 3,000? Does that match your medications or what quality of life you would like to sustain? That's one. That is critical because what tends to happen politically is that every so often at random, a 500 may be added on and you don't know what that is for and what sense it makes. And it doesn't please, it's not a win-win. So that's one. Two, what an area, a catchment area that I had hit on, and starting with my own alma mater. When you look at our culture, we host annually, at least we used to before COVID, annual all-inclusive fetes, which were funded and designed by the school's alumni. That is a whole pool of resources because especially the schools that we call the prestige schools, they have funds. Even Naparima girls did it with their cookbook. And the kind of revenue that they amassed, they were able to retrofit schools, they were able to get labs, you name it, they did it. Now, COVID might have catalyzed something here where no fetes. So what do we do in terms of using the alumni, both the guys and the dolls from their respective schools to raise, really have robust fundraisers and use that income towards building assisted living communities, facilities, where they can have as a critical mass their own, and then by extension, open it up to all affordable. And it is something that is self-sustainable. That's a huge area of resources. And we also have our migrants who are outside and want to come home. So you have a whole catchment area of people in foreign currency that will draw more in our local currency if they can start and do time sharing. If we can have these assisted living facilities with them coming over in the colder months and going back in the warm months, that's my idea. And last but not least, in terms of Douglas's point that he emphasized of getting, and Maria, of getting everybody on board, for us to know where these people are, what they do, especially in the informal network, we need to have community profiles. And that could be done with a combination of like local government, the regional corporation, social development, health, education, community development, going door to door to find out compositions in a household. Who are the persons with disability? Who are, I don't use the word shut-ins, but the ones who are housebound, because this could be linked to disaster preparedness, where to find people in terms of response time. So that once you have that done with robust research and you have a definition of each community's profile, you will know immediately where the clusters of our seniors are. You will know the genders. You will know what their needs are. And also, last but not least, what I was very intrigued about in 2011 was when America, when their retirees were beginning, the baby boomers were now beginning to retire, they were able to say the rate at which persons were retiring. We don't have that. So that if it is in the both private and public sector in their 5-year strategic plans, could make trajectories of the rate at which persons are retiring. Because one of the areas that Minister Ember didn't mention was the amount of early retirees. Because the culture of these retirees are not like our parents. Our parents were cut and contrive and conserve. But these and the millennials are more consume leisure and pleasure. So all about that whole catchment, we have to look at how they look at savings. So that is critical. So in those community profiles, you will be able now to make neighborhoods once more, because the very communities will become part and parcel of making those communities come alive, so that there will be an intergenerational mix of when people get back into knowing one another, and stop this reliance on the state. Private sector has to get involved, and the rural, because it is all these diversities in the variables that are causing us to be working in silos. I had it from firsthand, and I know what I'm speaking about. This is not on paper. This is not guess. We have to come together. Ministries, private sector, informal networks, migrants who want to come home, all of that are pools of resources. And the persons with disability, they too are aging. So at the end of the spectrum, you will have both the aged who are infirm, which is a disability in itself, mixing now with those who were born disabled and coming right up the chain and are now exacerbating that amount of seniors that will require different kinds of resources. That was the last thing that the United Nations was looking at, that instead of only hosting aging alone in conferences, they needed now to look at the coexistence of aging and persons with disability, because the assistive devices that would be needed are very similar for both groups. So we have to accommodate both. And last but not least, the government needs to really get a national plan of action on aging, which will be a countervailing and bringing everybody, where they can then establish an older person's authority, similar to the children's authority, where all elder abuse cases could be handled at a statutory level. That's
Thank
it.
you,
I think
Dr.
I did with 2
Rouse.
minutes.
So we
Thank
don't
you.
have more time. It has been a very interesting discussion, and I feel we have covered some of the most interesting topics. Thank you all. It has been a very lively conversation, and I have certainly learned a lot today. So thank you. I go back to Wendell now.
Thank you very much. Thanks to Renier Schlieser, Ignacio Pella, Douglas Camacho, Maria Daniel, and Dr. Jennifer Rouse for this interesting discussion. Thank you all. Lastly, ladies and gentlemen who are with us, we will have the closing remarks by CAF's representative in Trinidad and Tobago. Let's say good day to Gianpiero Leoncini. Hello, Gianpiero.
Thank you, Wendell. Good day to all. And I will just be very brief to thank you very sincerely to the Honourable Minister for his remarks, for the panel, to the panelists for this very substantive exchange, and to my CAF colleagues who worked so hard for this event to happen. I think we received very valuable insights, and that several challenges have been clearly outlined, in particular those that require us providing decent pensions to a growing aging population, as well as ensuring fiscal sustainability in the future, matching revenues and expenditure. And all this in a background, in a context of quick transformation of society that will deeply impact public policies in the next century. So, as it was outlined several times during this debate, this is an ongoing conversation where important decisions will have to be made in the next years. And from CAF's perspective as development bank, we believe it is our role not only to provide financing or technical assistance, but also bring ideas to the table, share best practices, and encourage a dialogue, as has happened today, between different sectors of society in order to try to generate a consensus with a long-term view about our public policies. So I would just like to say thank you once again and remind you that CAF remains committed to support Trinidad and Tobago in its path to sustainable development. Thank you very much.
Thank you very much for your words, Gian Piero. And that brings us and the presentation of the 2020 Economy and Development Report in Trinidad and Tobago to an end. On behalf of CAF, the Development Bank of Latin America, we would like to thank everyone who has taken part in this event. The report is available for download at www.cioteca.caf.com. That's cioteca.caf.com. Thank you very much from all of the team. Have a good day.